Hi, and welcome back to the staff training module on an introduction to borderline personality disorder. We'll be moving on to part two, which focuses on how you can help. My name is Alexandra Ferreira, and I'm a senior clinical psychologist at NUA Healthcare. In today's webinar, an introduction to BPD, how can you help? We'll be focusing on evidence-based assessment and intervention procedures currently used in clinical practice to support in managing the difficulties and risks associated to BPD. We will also discuss helpful guidance on how you can support an individual who has been diagnosed with BPD. This webinar is suitable for all individuals who are carers of those diagnosed with BPD. So throughout this part of the webinar, we'll be discussing a series of topics, and these include what can be done to help people who have been diagnosed with BPD, general management guidelines when caring for someone with BPD, how someone with BPD can stay well, and then we'll complete it with a summary of all the content discussed throughout this part of the webinar. So what can be done to help people who have been diagnosed with BPD? Once formally diagnosed with BPD, there are several treatment options available. One would be the medication or pharmacotherapy route. So there's no medicine currently licensed to treat core symptoms of BPD. Nonetheless, medication is often used with individuals with BPD to treat other mental conditions or symptoms that they may experience, such as depression and anxiety disorders. Mood stabilizers or antipsychotic medication may sometimes be prescribed to help with mood swings, ease psychotic symptoms, and reduce impulsive behavior. As mentioned earlier, people, when intensely distressed in the context of their diagnosis of BPD, they may have psychotic like symptoms where they may feel paranoid or suspicious of others' intentions. Their mood will fluctuate immensely and at an intensity that would not be commonly seen in those without BPD, and we'd see a lot of impulsive behaviors. So, whilst there is no medication to address BPD as a mental illness, there are medications used in the context of stabilizing the mood as well as trying to manage any psychotic symptoms that might arise in the context of acute emotion dysregulation and prolonged emotional distress. From a psychological intervention perspective, the type of therapy chosen should be based on a combination of personal preference and the availability of specific treatments. It is usually the combination of medication with psychological therapy that promotes the best therapeutic outcomes for individuals with BPD. So, with regards to psychological interventions in BPD, there are various that we can opt for. We have dialectical behavior therapy, which is a type of cognitive behavioral therapy specifically designed to treat people with BPD. It aims to help people understand and accept their difficult feelings, learn skills to manage them, and become able to make positive changes in their life from a behavioral perspective. We have cognitive behavioral therapy, or CBT, which is a very commonly known therapeutic intervention. It's an approach that focuses on maladaptive thoughts, beliefs, attitudes, and values underlying problematic behaviors, with the aim of developing skills to recognize and challenge these mental processes. As I mentioned in part one, people with BPD may have a tendency to distort what is actually happening in reality and misinterpret social cues, gestures, facial expressions, or comments from people, giving it a meaning that is not really there. The meaning being that this person is going to reject me or leave me. So, CBT, or cognitive behavioral therapy, really helps address these maladaptive thought patterns that maintain the difficult emotions and behavioral reactions. Mentalization based therapy, or MBT, is a long term therapy that aims to improve the person's ability to recognize their own and other people's mental states and motivation. Schema focused therapy involves recognizing and changing unhealthy and self defeating patterns of behavior using a combination of cognitive, behavioral, and emotion focused strategies. And then we also have art therapies, including art therapy, dance movement therapy, drama therapy, and music therapy. An individual or group therapy used to help people interpret, express, and resolve their emotions and their thoughts. So as I mentioned in part one, BPD is very much about alterations in thought processes, emotional experiences, and behavioral patterns. So, if we look at the therapeutic approaches and the interventions that are available to support with BPD, they target mainly the emotional, they target all of these areas, but there's major emphasis placed on the emotional part as well as the thought patterns, because these are usually the first things to target and will support them in managing and changing the behavioral patterns. So all of these are used. However, in clinical practice, we would commonly see used DBT, so dialectical behavior therapy, and CBT, cognitive behavioral therapy, despite all of them having very good evidence based research in the context of supporting those who are diagnosed with BPD. The main aim of therapeutic intervention for individuals with BPD includes the development of specific skills, and these are emotional awareness, self awareness, so awareness of triggers, of common responses to specific situations, etc., adaptive emotion regulation skills development, stress management skills, development of self concept and positive self esteem, relational and communication skills, mentally and emotionally process previous traumatic life events that may still be impacting on the individual's thought processes today, reduce and replace risk behaviors for more adaptive self regulating behaviors. So, as we see here, we're addressing the emotional components. The more aware someone is of their emotional difficulties and challenges, the easier it is for them to start targeting them and acquiring adaptive coping strategies as opposed to the impulsive and self sabotaging and damaging or self destructive strategies that were referred to in part one in order to manage these emotions in a more effective way. And with that as well, the idea is just to keep the person's emotionality at a manageable base as much as possible and work on the relationships that they have with people, the social support network that helps as well with that co-regulation piece. Equally, it is important to support the person with regards to their thought processes. Again, if we do not change the maladaptive strategies or the maladaptive thinking patterns that they have developed, they're going to continue to distort reality inadvertently, unwillingly, but they're going to continue seeing things in others, in relationships that are not necessarily there, but really stem from previous experiences or an internal lens that they developed in order to protect themselves from abandonment and rejection. So the skills focus primarily on the emotional component, so the emotional challenges that they face, the thought patterns that they have, and the behavioral patterns that they have. All of the areas are targeted by psychological interventions, and medication helps in trying to promote further stabilization for the person to have more meaningful engagement in the psychological intervention. General management guidelines when caring for someone with BPD. As mentioned previously, the impacts of BPD extends beyond the individual and negatively affects family members, friends, and carers. There are several management strategies that, as carers, we can implement in order to support individuals with BPD, strengthen relationships, and promote deeper understanding and cooperation in the management of symptoms. These include remaining calm and consistent at all times and trying not to let the person's intense emotions trigger an emotional reaction in us. If you're experiencing intense or unstable emotions too, there is a greater likelihood of escalating the situation. I'm sure many people are familiar with the expression aggression generates aggression. And that is it. If the person that you're supporting who has BPD has an intense emotional response, if we give back or respond with an equally intense emotional response, this is not going to help the individual regulate. If anything, it will exacerbate their emotions even further. So remaining calm and in a consistent way is very important. And it helps us being able to support the individual in de-escalating and coming back to their own baseline rather than escalating them further. Offering ongoing support. So, this may be particularly difficult if you feel attacked by the person without any perceived reason, but this is when they need your support the most by showing you will be there when they are calmer. So, with this, it's showing that you will be there regardless. Remember that when we speak about BPD, one of the core features and fears is fear of abandonment and rejection. That's not to say that during an episode or a situation where a person is highly dysregulated and they may maybe become verbally aggressive, or they may shout at us, or have an outburst toward us, even if we're not the actual trigger, it doesn't mean that that is something that we should be okay with or should be tolerated or that it should be accepted. It's just making the person aware that you are there, you understand the difficulties that they have, both in recognizing their challenges as well as controlling their difficulties, and that you are there. And when they're calmer, you're going to be there to support them to continue on with the steps that they need to take, which ideally will be with the support of a mental health professional. We'll look more into that in a little while. But being there basically unconditionally. So it's okay to walk away and tell them that that you're walking away in a moment where they're potentially calling names or they're very angry and they're shouting at you. It's not a matter of sitting there and saying that that's okay, but it's a matter of saying, right now, you're very upset and I can see that. So I'm going to give you a bit of space and I'll be back in a bit and we can talk then. Or you can come and find me maybe when you're feeling better and we can talk at that stage. I'd be more than happy to. It's just recognizing the lack of controllability, particularly in the initial stages, or if the person is feeling emotions too intensely, they're not able to. So you're there to show ongoing support. Learn about their triggers and help them to manage these. So, for example, leaving an appointment or going grocery shopping. Each individual has their own triggers. And people that don't have any mental illness will have triggers, things that will upset them, things that will activate emotions in them. With BPD, as we know, activation means oftentimes intense emotion dysregulation. So, as a carer, as a family member, as a loved one, as someone who's there to support, it's very helpful to support them in identifying what their triggers are, keeping track of them, or supporting the person in keeping track of them, and knowing how to manage them when they pop up. Let's say, for example, the individual gets very anxious or is triggered by the fact that they're leaving home to go to an appointment, and appointments are very triggering because in appointments maybe the person is being asked to talk about things that they don't feel comfortable about, or they know it's going to cause a dysregulation. Despite them knowing that it's beneficial, it's still an unpleasant experience. So if this is the case, then it might be helpful to not only identify this, know beforehand, this is a situation that's going to trigger the individual. I'm going to be there to support them. I will escort them to the appointment, be there when after they leave the appointment. But equally, it might be good for, in this particular situation, find strategies with the mental health professional or strategies that the individual has identified that has worked before to use when the situation arises. So it could be the case that the person goes to the appointment, but they feel very relaxed usually when they listen to music. So maybe listening to a particular type of music that soothes this person could be played in the car on the way to the appointment. And this is a form of trying to manage the trigger. We can't avoid this trigger, but it's manageable through the use of coping strategies. And that's just an example. There are many, and a mental health professional can certainly support in identifying further coping strategies in ways to support with triggers that have been identified. Validate the person's emotions and do not make reference to their behaviors or the way that they express a particular need. So, a lot of the times, an individual that is experiencing a difficult emotion that has BPD, the way that they go about expressing the emotion might not be appropriate. They might shout and scream at someone, they might engage in name calling. In more extreme cases, people might break objects. They might engage in impulsive acts like binge drinking or binge eating. So there is something that triggers them and causes this intense emotional distress. And then they engage in a certain way to express to you or others how they're feeling, but they lack the words to be able to describe it. And usually they engage in things in an impulsive manner. So they usually act before they speak and are able to reflect on what just happened. It's important to validate the person's emotions. These emotions are stemming from somewhere. They're stemming from fear of abandonment. They're probably stemming from attachment difficulties from the past. They're stemming from perhaps the way that they see themselves. They're stemming from poor self-esteem. They might be stemming from a fear of not being good enough. There could be so many things that could be leading to the way the person's feeling. Um, but the feeling that the person has, it's important that we validate the feeling. Even if it's very intense, disproportionate to the situation, validation of the feeling is a very important part of the healing process. Oftentimes, people that have had traumatic experiences, and with that BPD, because in most cases, BPD individuals with BPD have had those traumatic experiences, they haven't always had the opportunity to receive validation for the emotions they experience. So, validating the emotions are important, but we shouldn't validate the way that they're expressed. So, the shouting shouldn't be validated. If there's breaking, it shouldn't be validated. If there is consuming alcohol in large amounts, it shouldn't be validated. So, we can do this by simply saying, I can see you're very upset right now, and I'm here to support you in whatever way that I can. This must be really hard for you. In this short sentence, I did not make any reference to the behaviors, so the way that they probably lashed out. I did not refer to, in the example I gave, to the substance misuse, to the way that they tried to cope with the situation. I just referred to the fact that they were upset. Oftentimes, we find that this helps the individual calm down by the simple fact that they feel like their emotions are validated, seen, and heard. Show openness and willingness to understand their emotional experiences. So, if the person is willing to, in a situation where there's been validation and they've calmed down a bit, give them the space to speak about their emotions, but in a way that doesn't overwhelm you, in a way that that is not the only topic of conversation that you have with the person. But it's certainly important that they feel like they have a protected space, a safe space with a trusted person, if you are. For them, a trusted person to talk about what's going on and what happened with them and reflect on what just happened. Support them in managing their treatment plan. So, this includes suggesting coping skills, supporting them in implementing adequate coping strategies, encouraging them to contact a therapist, encouraging them to practice self care. So, when supporting someone with BPD, particularly if they have received a diagnosis of BPD, it is important to support them and to encourage them to attend their appointments. This is something that they might want to avoid because, as mentioned earlier, there are a lot of relational triggers for people that have BPD, and therapy is primarily based on a therapeutic relationship with a therapist. So, that in itself could be triggering and it could be difficult for the individual to build a trusting relationship. It may take longer than it would with someone who doesn't have BPD. So, encouraging this step is very important because that is where the guidelines and the supports are going to come into play with regards to the therapeutic interventions, the recognizing the difficulties a person has, understanding their triggers, coping strategies to manage their triggers, recognizing what are their go to strategies at the moment that they use to cope with the negative emotions, that are maladaptive, that are self-destructive, that are damaging to themselves or others, and replace them with more adaptive coping strategies, such as the ones that are learned, for example, in DBT, dialectical behavior therapy. The list goes on of the kind of support and intervention that can be provided to someone with BPD, but this is a very fundamental part in supporting them to get on track and have a treatment plan, and then for you to support them in adhering to their treatment plan. Try to manage your own emotions and reactions. As mentioned before, when supporting someone with BPD, that intense emotional reactivity that they have, things that they may say, the misinterpretations that they may have in relation to us, they might perceive us crossing or folding our arms as us showing disinterest in the conversation when we might not be doing that with that intent, and that might result in a reaction in them. So the dynamics could be quite complicated, but it's important that we maintain calm and we contain our own emotional response so that we don't need to further escalation in the responses of the individual. By doing that, they become more emotionally dysregulated, and there's a higher risk of them engaging in impulsive and dangerous behaviors to self-regulate. Be trustworthy and reliable. Only make agreements and promises if you're able to carry them out. If you're not able to do that, or if you make a promise and you do not follow through, you are feeding into the idea that this person maybe already has, if they developed an insecure attachment style, as discussed in part 1 of this webinar, that the world is unreliable and people are unreliable. So what we're trying to do is to show this individual that we are reliable, we are a safe space, we're a safe port that they can count on. Obviously, boundaries are required, but if we do make any agreement with them or anything, if we say anything to them that we're going to do, we need to have very clear communication, particularly if we're making a promise. We need to say it's a promise. If it's not a promise, we need to clarify it is not a promise. It's something that we're going to try to do. But when we do make those kinds of agreements and promises, we need to adhere to them. If not, we'll let the person down. And that there in itself can be identified as a sign of rejection or abandonment by the individual, and then lead to an intense emotional response. And we need to be consistent with our reactions in relation to this. Due to the individual's unstable and negative self-image, you can support them by reminding them of their positive traits and expressing your positive feelings for them. This is very important, particularly from a co-regulating perspective, but also that social support that they need. And also their tendency will be to, a lot of people with BPD, a lot of people with trauma, their tendency will be to focus on more negative things than positive things, particularly in relation to themselves. So it's important that we remind them of what the positive things are, and ideally they would start to engage in that practice on a daily basis, which usually is incorporated into their treatment plan as well. Offer healthy distractions, for example, relaxation strategies, pleasurable activities, a soothing cup of tea, for example, from their emotional pain. So as mentioned, they experience intense emotional pain, and sometimes the only thing we can do to support an individual is distract them from that pain as they acquire the skills, as they process the pain. Particularly if the emotional pain becomes extremely overwhelming, distraction is the best way to try and get it back down so that the individual could address it at a later stage. And by doing these activities, particularly by engaging in them with the individual, it is really helpful for the individual to feel supported and to seek acts of kindness and care in the context of their needs that most likely were not met when they were growing up or at some point or some very critical point in their life. So, general management guidelines when caring for someone with BPD. Individuals with BPD can be seen as presenting with undesirable behaviors that have some poorly understood reasons, such as getting something from staff or manipulating them. However, we need to reframe our perceptions and view them as people struggling with their history, their development, or emotional needs. Challenging behaviors can try to meet underlying needs for positive reinforcement. So people may engage in challenging behaviors because they're trying to get social interactions and getting people to care for them, an activity or basic need to be met. So they might be trying to access food or drink or toilet facilities, and for some reason this might not be available at the time. So they might engage in a behavior to get access to that, which is a basic need. And there might be sensory feedback to the body and brain. So they might be trying to engage in a particular activity in order to get that sensory feedback. This will be very dependent on individuals' specific clinical profiles. We're talking about individuals with BPD, but we know that there could be comorbid conditions such as anxiety, depression, and people with BPD can also have comorbid neurodevelopmental conditions such as autism, ADHD. So it is important to take into account the individual's clinical profile and what they need. But when we're talking from a, a BPD perspective, they might be engaging in certain behaviors to get these very specific needs met, or for negative reinforcement to make something unwanted stop or go away. So they don't want to engage in a task, they might engage in a certain behavior. They have an upcoming meeting with a family member and they find it very triggering. They might engage in a behavior to prevent that meeting from going ahead. In addition, behaviors of concern may be related to the person's tried and tested method of relating to others. It's important to note here that people with BPD, as mentioned in part one, typically come with a lot of traumatic experiences and attachment issues, meaning that during their childhood and adolescence, while they were growing up, it was likely that their needs were not met. Their safety needs, their emotional needs, physical needs, etc. And that means that a lot of the times while growing up, they were forced to find other ways to get their needs met. And this could have been through verbal communication, it could have been through escalation in their emotional state to get attention from their caregivers to get those needs met. It could have been an escalation in behavioral presentation, so throwing things, punching, kicking doors. They could have found multiple ways to try and get their needs met. And the thing is that at that stage, they were in a stage of survival. If they didn't do that, chances are their needs were not going to be met. The thing about people with BPD that have had these experiences is that they haven't quite realized yet that they don't need to resort to those methods anymore. Those methods have worked for them on many occasions, which is why they continue to utilize them. It is only when we show them that there are alternative methods that they will stop engaging in these behaviors. Unfortunately, this is not enough in itself, showing alternative methods. What we need to do is we need to show them that the methods that they're currently using right now in the setting that they are in do not work. And that will then lead them naturally to try and look for alternative methods, which we will be there to support them with. So instead of someone becoming very upset and wanting, for example, to get staff to pay attention to them or to listen to what they say, and instead of them starting to bang on doors and scream loudly, we need to show them that's not going to work for them to get this need met. And rather, there is another strategy where they can actually go up to a staff member and say, can I please have 5 minutes? I really need to talk. I'm not feeling too well. So we need to shift this whole pattern of ways of thinking, of ways of behaving. And we need to basically move and shift this instinct that they have to engage in these behaviors for survival to more adaptive strategies. And that is done through consistency, and that is done through boundary setting, and that is done through upskilling the individuals with regards to relevant skills in the context of emotion regulation and interpersonal skills as well. It's important to stay calm and respond to the emotion and not to the negative behavior. We need to focus on the emotion that is coming up. This will lead to a set of behaviors that the person is already used to engaging as a form to regulate themselves, or as a form to get a need met. We shouldn't pay attention to these behaviors. We should focus on the need instead. There's a need, generally an emotional need that is trying to be met, that they struggle to have gotten met in the past. And we should focus just on that. So it can simply be addressing the individual and saying something along the lines of, I can see you're very upset right now, and this must be very hard for you. I'm here for you to support you in whatever way I can. Would you like to talk about it? How about we have a sit down? In this sentence, or in this script that I have just utilized, I did not once refer to behaviors or responses that they had. I focus on the emotional pain that the individual is experiencing, which generally supports them in reducing and coming back to baseline and being able to address it in a more adaptive manner. But also, we're giving them the space to do it by prompting them, by validating that emotion, by acknowledging it, and by asking if they would like to use space to talk about it. So validate their feelings. As I mentioned, other examples can be used. I'm sorry you're feeling so bad about this. Sounds like you're going through a very difficult time. Reassure the person you're there if they need support, and remind them of other supports available for them. So, for example, if they're availing of therapeutic intervention with clinical psychology, psychiatry, occupational therapy, we can revert them back to the supports where appropriate and within the scope of each discipline. If appropriate, redirect the person to an activity that they might enjoy, and ideally engage in the activity with them so they feel supported, and we do not activate or trigger any fear of rejection. Um, it is very likely, and it's quite common for people that have BPD, that in their life, when they have demonstrated these intense and very difficult emotions, that they have been pushed back for them. Because as we know, these are not appropriate ways of demonstrating emotions as per social and cultural standards. So that there could be perceived as a sign of rejection. Now, obviously, we want to change the behavior. We want to change the way they express themselves emotionally, but we also want to show them that we are there on an ongoing basis. So it's important to do activities that are positive, pleasurable, enjoyable, distractible together. Do not comment or respond to the details of self-harm, suicidal ideation, as this could reinforce the behavior by providing too much of a reaction. Some people, as I mentioned in the slide before, they might engage in a behavior to try and get a certain reaction, or get attention, or get care from staff that they feel they're not getting. So it is important that we only focus on the emotion and not on the behavior, because if we focus on the behavior, if we talk, for example, about someone who's just self-mutilated, and we talk about the cuts, we talk about how they shouldn't do that, how, we worry when they do that, how how close it was for them to actually causing severe damage. If we focus on any of these aspects, which may be true, we'll be reinforcing this, because we're showing them that this is what we're paying attention to, not what led to the behavior, which is the emotional experience. So we avoid talking about the behaviors and focus just on the acknowledgement and validation of the emotions, by using some of the scripted responses that I've already said and that are on the slides, just focusing on the emotion. Ensure that all SOPs, so standard operating procedures, behavioral plans, risk management plans, etc., are being followed consistently by all staff members. From an attachment informed care perspective, there are several principles that we can follow to support an individual. And this is important because most individuals would have experienced attachment difficulties and would have developed insecure attachment styles with their caregivers or attachment figures. So, bearing this in mind, staff and the teams can contribute to increased emotional security in relationships, things that these individuals are not used to or have not experienced before, by providing attachment informed care. The main principles are, for example, having a core team. This doesn't necessarily mean having an actual core team composed of specific people, but some cases it may be required. However, the core team is important so that the person knows, or always knows the staff that are available to support them and has the opportunity to form good relationship with them. It's an opportunity to work with the same people on an ongoing basis and build relationships, because they will need that time. They will need time to build the trust. They will need time to become familiarized with the staff, and vice versa. Staff reliability. So, not only being physically present, but also following through on promises and arrangements made with the person, but not promising what you can't deliver. These individuals, due to their insecure attachment styles, due to possible traumatic events in their lives, they have developed perceptions of themselves in the world that might not be accurate but cause them a lot of distress. And it's not uncommon for people with BPD to develop this idea that the world is unpredictable and people are unreliable and people are hostile. So it is important that when we're engaging with the resident, we use clear communication, we use honest communication, and whatever we communicate, we follow through on, especially when it comes to making specific arrangements or making promises. We need to follow through on that so that they can see that we are reliable, so we can challenge this belief that they have about others that has been implemented in them from a very young age, most likely, and we can challenge them and show them that that is not necessarily how people work and how relationships work. Consistency. Staff should follow the same procedures and routines around tasks as a way of ensuring a supportive and predictive environment. This is fundamental in working with people with BPD. The consistency, not only by the same staff following always the same procedures and the same approach, but every staff member working with individual following the same procedures. If there is any inconsistency whatsoever, it just brings back for the individual all of these thoughts and beliefs that they had about themselves in the world, which are very easy to fall back on since they've been around for a very long time. So the consistency is fundamental to start promoting safety, predictability, and allowing for trusting relationships to build, and for these individuals to experience different kinds of relationships to what they have had in life before. Healthier relationships. Warnings of staff holidays and breaks, and reassurance of return to help avoid re-experiencing feelings of abandonment. So if we leave and we do not notify the resident that we're going to be away for a period of 2 weeks, for example, they might perceive that as we've left. These individuals are also exposed to high levels of staff turnover where staff leave, and sometimes they're not communicated about the staff leaving. So ultimately, they're just exposed to reliving a situation where they've been rejected or abandoned by someone, even if that's not the case. We know that people move on due to their own professional and personal goals and endeavors. So we know that, but these individuals have had a very different experience in life. So it's important that we keep an open communication with them at all times, and again, promote that predictability. Expression of emotional distress should be facilitated at the house on a daily basis in order to avoid buildup of arousal. So, using creative or safe means of expression. This can be done through different therapeutic approaches. This could be done through engaging in certain physical activities where the individual has an opportunity to release emotional distress and stress in general, and also giving them an opportunity on a daily basis to have a sit down, protected time with a trusted staff member where they can talk about how they're feeling, their concerns, and where their emotions can be acknowledged, validated, and they can be reassured regarding the support they're receiving within the house. Also, another principle would be to be alert to the person's triggers for challenging behavior, indicators of increasing arousal, and strategies to help them de escalate. Individuals with BPD will have their specific triggers, and these will differ from person to person. They might not be very evident to us, so it's something that we learn as we get to know the person. But it's important that we are alert of the person's triggers so that we can either avoid them or manage them depending on where they're at in terms of their therapeutic progress, depending on their ability to manage their own triggers and emotional responses. So it is important that we are familiarized with that to a great extent so we can support the individual in avoiding or preparing to manage when a trigger is faced. Emotional containment and support should be provided in the home. This is engaging in nurturing activities, on a daily basis, such as conversations, relaxation, listening to music, etc. We need to support the person with their emotional challenges, which is one of the prominent difficulties in BPD. And emotional containment, so containing those emotions, it will be required. From a staff will be required to support with this in the context of engaging the individual in activities that help with emotion regulation, that help with emotional containment. These can be distraction techniques, these can be adaptive emotion regulation strategies. A series of strategies can be developed in conjunction with a clinical psychologist, for example, or an occupational therapist in the context of more sensory based needs. Some individuals respond well to sensory based strategies. So there are multiple clinicians who could support within the context of developing skills and strategies, as well as multiple group therapeutic interventions that support with acquiring skills in the context of emotion regulation. But it is up to the staff team to be able to proactively address it on a daily basis in order to prevent these escalations and to help the individual to identify when they're coming, this period of emotion dysregulation, warning signs of emotion dysregulation, and to support with the containment through engaging in proactive emotion regulation strategies. The person should be encouraged to engage in community activities as a way of distracting them from negative internal states and having positive experiences. By doing so as well and having positive community access and engaging positively in community activities, we're also supporting them in the context of building a positive sense of self-esteem and self-confidence as they accomplish new goals within the community. Emotion regulation difficulties can be quite common as well in individuals with BPD. As I mentioned, this would be one of the most prominent difficulties that we see. As children, most of us typically learn how to manage, express, and cope with our emotions in a healthy way. For people with BPD, emotion regulation is much more difficult sometimes due to painful childhood experiences, such as traumatic experiences, attachment difficulties, and sometimes because of not having been shown or taught how to manage their emotions. So, a child needs to be taught how to manage their emotions in a healthy manner, and not everyone is given that chance. For those who have experienced trauma in childhood, for those who've experienced attachment issues in childhood, rarely would they have been given the chance to acquire healthy coping strategies. And actually, more common than not, they would have acquired maladaptive coping strategies by learning from their caregivers. So, for example, shouting, engaging in physical aggression, substance misuse, etc. The symptoms of BPD, including mood shifts, self harming behaviors, intense impulsive behaviors, may all be related to one core feature: emotion dysregulation, which is why emotion dysregulation is at the core of intervention, both pharmacologically, mood stabilizers, as well as from a psychosocial perspective, emotion regulation strategies. Because from this emotional dysregulation is where we see more negative behavioral patterns emerging, negative thought patterns exacerbating due to the emotional states. So it is through the emotion regulation difficulties that we need to, this is what we need to target in order to support a person with BPD to be able to start shifting their thinking and behavioral patterns as well. Because of this emotion dysregulation, people with BPD may have very strong emotional responses and difficulty managing those responses independently. We can support people with BPD to develop better coping skills to manage difficult situations and emotions. Example of coping strategies include self-soothing, so they're comforting through five senses. We could do this by supporting them to engage in a grounding technique, which is the 5-4-3-2-1 technique. So, for example, supporting them to seek something to touch, like a stuffed animal, stress ball, something to hear, for example, music, meditation guide, um, something to see, for example, a snow globe, a happy pictures, something to taste, mints, sour candy, tea. And the fifth one would be something to smell, so like a lotion, candles, perfume. This is one where you ask them to engage in one, so to engage in one task for each sense. The 5 4 3 2 1 is a different one where you ask them to identify five things that they can see, four things that they can touch, three things that they can hear, two things that they can smell, and one thing that they can taste. There are multiple variations of this, but this is a grounding technique that helps the person essentially step a little bit out of their head and focus on their surroundings and the present moment. We have distraction techniques that helps take people's minds off the problem for a while. These could include puzzles, books, artwork, crafts, knitting, crochet, Sudoku, positive websites, music, movies, etc. We have another strategy which is opposite action. So doing something that is opposite of the impulse that is consistent, and that's consistent with a more positive emotion. So as we know, when there are emotional difficulties, the person may have a tendency to engage in certain impulsive behaviors or in certain behaviors as a way of coping. So we try to engage them in positive or opposite action to counter this. So for example, an example of this could be affirmations and inspiration. So looking at a drawing, looking at a motivational statement or images when, for example, they are having negative self talk in relation to their abilities, in relation to their own person, doing something or watching something funny or hearing something funny, like on TV, watching a funny movie, watching a funny video when they feel very, very low, and we see that their mood has dipped to the point where it's really hard to get them up. So these would be examples of opposite action. We also have other strategies such as emotional awareness, so tools for identifying and expressing feelings, encouraging the individual to list a chart of emotions, to journal what they're feeling at that time and what thoughts are going through their mind. Um, Drawing, for example, if they're not able to express it in a verbal way, they could draw what they're feeling. So these are ways to promote emotional awareness and see exactly, or try to identify a bit for themselves how they're feeling, and then they will identify over time the patterns, and become more emotionally aware. Mindfulness, so tools for centering and grounding in the present moment. So we can encourage the individual to engage in meditation or relaxation recordings, engage with grounding objects like a rock or paperweight, engaging in practices on a yoga mat like stretching or yoga, breathing exercises, etc. Another strategy, and actually this is a very important one, would be having a crisis plan, and that would be something that the clinical team would support with. So the contact information of supports and resources for when coping strategies are not enough, for when the person becomes too dysregulated or the person is engaging in behaviors of risk to themselves or others. So it will have a list of family, friends, the psychologist, the psychiatrist, hotlines, escalation protocols, SOPs on what to do in specific situations should the person become overly dysregulated and staff are not able to contain, both from an emotional and behavioral perspective. Other ways to support an individual with BPD include helping the person name the emotion that they're feeling, being a good role model for healthy emotional regulation. So it could be the case that sometimes an individual might be feeling frustrated and waiting in a queue. So we could demonstrate, for example, a mild feeling of frustration as well due to not wanting to wait in a queue. And we can demonstrate how we can manage that emotion in an effective way, modeling it to them by demonstrating we're frustrated too, but we can manage it effectively without engaging in any maladaptive behaviors that perhaps the individual does in order to self regulate. Allowing them to see that it's okay to feel negative emotions, but it's how we deal with them that counts. So it's important to normalize negative emotions and to explain to the individual on a continuous basis, really, that they're part of life and they will always be there. Sometimes they'll be there more prominently, other times they'll be less prominent, and there'll be more positive emotions. But that emotions essentially are important guides in relation to how we are feeling internally and kind of dictate what we need to do. And they're important guides for our life, and that we need to gently start reframing the way they view these emotions, and that it's okay to experience them. Providing positive feedback and encouragement when they handle a difficult situation well, by using appropriate strategies or by not engaging in maladaptive ones. Encouraging them to attend therapy appointments if they are linked with a clinician. With regards to communicating with individuals with BPD, individuals with BPD can have trouble reading body language or understanding the nonverbal content of conversations. The disorder can also distort both the messages they hear and those they're trying to express. So it is essential to use clear, honest communication at all times. Studies have shown that individuals with BPD can look at a neutral facial expression and give it a negative attribution, thinking that the person might be thinking negatively of them, that it is an expression of disapproval, of displeasement, discontentment in relation to themselves. So we found that again, because of their distorted way of viewing things, and this is purely based on their experiences in the context of trauma, in the context of insecure attachment styles, they will struggle in identifying it. So it's important that we explain to them in the moment, provide immediate feedback whenever possible, what is actually happening and what interaction is actually occurring, and what is that you're trying to transmit through your body language or verbal communication that they might not be understanding. So using clear communication to clear up any misunderstandings in the immediate situation is highly important to prevent escalation and to prevent misinterpretation of signals. Tips for communicating with someone with BPD. So, know when it is safe to start a conversation. If the person is heightened, postpone the conversation until the person has calmed down. Say something along the lines of, let's talk later when we're both calm. I want to give you my full attention, but that's too hard for me to do right now. And you can add something along the lines of, I'm going to give you 20 minutes and I'll be back in 20 minutes to check in on you and see how you're doing. This is important because what you're doing here is you're showing the individual that just because there is conflict at that time, they're becoming emotionally heightened, it doesn't mean that that's going to result in the rupture of the relationship. You're just going to take a step back, allow them to self-regulate and come back. Possibly something that they're not used to if they have had insecure attachment styles and relationships across their lifespan. So you're showing them that just because they're having this emotional dysregulation doesn't mean you're going to leave them, but that they need to be able to engage in a certain kind of conversation in order for it to be productive, and for that they need to be in a certain state which is calmer than what they are now. You're also showing them that there are boundaries, so that there are certain things that when they engage in certain behaviors, they can expect certain reactions from you, such as you're going to leave them and help to allow them to self-regulate and then come back and support. And if this is done consistently, they know what to expect from you. And then this gradually leads to changes in the behavioral patterns. And finally, you're showing that you're there unconditionally. You're still going to come back so long as you come back at the time that you have stipulated. They will feel that you are reliable, that you're supportive, and that you're trustworthy, and they can count on you for support. Listen actively and be empathic. Avoid distractions such as the TV or phone. Try not to interrupt or redirect the conversation to your concerns. Set aside your judgment, withhold blame and criticism. It is important that we show these individuals, particularly when they try to express their concerns and their emotional challenges, that we pay them full attention, because it is extremely difficult not only to experience the emotional distress, but to actually find ways to verbalize it and communicate it to others. So we need to be able to actively listen to what they're saying, and that is looking at the person, establishing eye contact, having our shoulders and our feet pointed in the direction of the person, and minimizing the distractions in the environment so that the only focus that is on them, and we can hear what they have to say. We can give the information back to them to make sure that we're following what they're saying, paraphrasing things. We can nod. We're showing them that we're actively engaged and we're understanding what they're trying to say. And once again, the important thing is to focus on the emotions. They are trying to communicate their emotions to you, so emphasis on that, acknowledgement and validation of the emotions. This is a very important part for them to start learning that there are more adaptive ways of expressing themselves and feeling reassured and safe as opposed to engaging in their typical behavioral patterns. Focus on the emotions, not the words. People with BPD need validation and acknowledgement of the pain they're struggling with. Validate the person's feelings, do not undermine them. Sometimes people with BPD can express their emotional pain through very maladaptive ways, in that they can verbally or even physically target certain people, staff members, out of their own pain. That pain is actually not in relation to that individual. It's a pain that's been there for a long time, that hasn't been dealt with, hasn't been processed, and it's still there. And the only thing that happened was that that one particular individual who has been targeted has triggered this pain in the individual with BPD. So sometimes they might say things or do things that they don't really mean. It is again that intense emotion dysregulation that results in impulsive actions, in engaging in certain urges that they feel will help them regulate themselves. But oftentimes you realize sooner than later they are very apologetic and remorseful for that because they didn't really mean it. At that time, they were out of control and they weren't able to communicate their emotions in any other way. As part of therapy, it is to support the individual in communicating and expressing their emotions in a more adaptive way. And it's important that we don't take the things that they say to us when they're negative like that personally. It is their way of trying to express how they're feeling, but they just are not able to in any other form. So we do not focus on the behavior, we do not focus on the words that we use, we do not focus on the action. We acknowledge and validate the emotion, the being upset, the being angry. That's what we address and we validate it. Set and maintain boundaries for behavior. Setting limits helps the person know what is expected from them and what they can expect from you. It will help them handle the demands of the outside world, like following rules in work and college, a lot better once they've started to do that in a residential setting, and allows you to build trust and respect with the person. Setting boundaries really does help show what a healthy relationship looks like. Again, most individuals probably did not have that chance while growing up. And by setting the boundaries, not only are we managing expectations on both sides, but we're also promoting predictability in that if we say we're going to do X, the individual knows we'll follow through with that. And also the individual knows that if they engage in behavior Y, we're going to engage in this behavior because this is something that we would like to see change. For example, take a step back and give them space to regulate. Creating these expectations allows to create predictability, and with that, trust builds. Not only trust builds, but also they're able to start feeling safe within the relationship. That is how you promote relational safety. But it needs to be done in a consistent manner, not only by one single staff member, but by every single staff member on the team for it to work, or it's not going to work. And the behavior will keep on continuing. We won't see any changes in that behavioral pattern. Personal boundaries are essential. Maintain your personal professional boundaries. Keep work life and home life separate. It is okay to build rapport, but keep personal information to a minimum and do not overshare. The person may use it against you when heightened, which may cause then resentment in yourself. The person may attempt to ask you personal information. Be prepared to respond in a polite but firm way. It is important to keep this clear distinction between our personal life and our professional life. These residents come into the service and they have probably worked with many, many staff members before. They come into a service or in a service where everyone knows everything about them, but they know very little about the people they're working with. So it is very natural that they will reach out and ask for information on people, but it is important that we are cautious in the information that we share. We do not share personal information. because again, that could be thrown back at us in a moment when they're heightened, and it can be very hurtful and hard to manage. Instead, it is important that we do share information. It's important that we show what a normal relationship would look like and resemble, which is exchange of information. But it is suggested that the information shared would be much more in line with interests and likes. Like, for example, what are your favorite movies? What are your favorite dishes? What are your favorite activities? This will help give the resident an idea of who you are, and they will be able to get some information on you. And equally, there may be an opportunity to identify common interests, which will help further promote a positive and trusting relationship over time. Boundaries. Individuals with BPD fear abandonment and rejection, so they will be sensitive to anything perceived as such. New boundaries may cause the person to react badly initially, as it might be seen as a rejection of how they usually present, because ultimately a boundary is saying you cannot engage in this way or you cannot do that anymore. So again, consistency is key, and calmly we need to reassure the person and ensure that all staff are reinforcing the same boundaries. Should these boundaries be broken, this may reinforce the negative behavior or the maladaptive behavior, and the cycle will continue. So it is important that the team all agrees on what is the boundary that we want to implement. What is this maladaptive behavior that we want to see change? For example, it might be engaging in verbal aggression towards staff or making derogatory comments towards staff. So it is important that the whole team firstly agrees on what the boundary is. No more derogatory comments towards staff. Should the resident engage in these comments, staff are to tell the resident that this is something that is not nice and it's not something that they will tolerate. If they would like support with anything, they can ask. They can request for some time to speak about their concerns. If they're feeling anxious, they can speak to staff, they can write things down. If they're feeling anxious in relation to a particular staff member, they can request to speak to another staff member, giving them options on how to engage. So alternative behaviors, so that this behavior is basically the boundaries in relation to this behavior, so that this behavior changes. So we need to give them alternatives. We need to explain why this boundary is coming into place. So first, the whole team selects what the boundary is. Second, it is communicated to the resident why the boundary is coming into place and why this is important for the residents as well. Many times when engaging in verbal aggression, the residents then frequently feel guilty and remorseful because they engage in that kind of behavior. So this is to support the resident. This is to help promote more positive relationships in the future. And thirdly, then, it's about the implementation of the boundary in a consistent way where every single staff member reinforces this boundary in every instance that it is required. It takes only one instance or one staff member to not follow this boundary for that behavior to continue. Because what happens is that behavior will continue serving a purpose. It will continue being able to help the resident to get a need met, even if it's just with one particular staff member, which will not promote any motivation to change. And that is how we work as human beings. So it is important to take this into account, that the consistency of everyone engaging in it is important to promote behavioral changes. Self-care. Working with people with BPD can be rewarding, but also intense, and it can lead to burnout if we're not careful. It is essential to engage in regular self-care and safe emotional working to prevent burnout. So when we talk about self-care, we're talking about the way that we feel, particularly when we're working with individuals with BPD in this context, in this webinar. And sometimes the relationship dynamics can be very intense. There can be a lot of conflict, and we can have negative emotions too, resulting from those interactions. Some common reactions or experiences that we can have as supporting staff members, carers, can be feeling pulled to the rescue of the person, an intense like or dislike for this person, feeling manipulated, frustrated, or angry with this person, doing more than you usually would, for example, disclosing personal information or giving out private mobile numbers, bending the rules for this person. and sometimes also having difficulty providing a consistent response due to the push-pull nature of this disorder. So it is very common that working with individuals with BPD is challenging, and it is experienced as challenging by most people. As a result, we may have these very normal reactions in ourselves, and it is important as part of our own self-care to prevent burnout that we are conscious of our mental and emotional states when working with the individuals. So it is important to be aware of our emotional responses, of what we're feeling inside, even if there's no reaction, if there's no emotional reaction accompanying it, and we need to monitor it. It is essential to ask for support and debrief with another staff member about these feelings. It is even likely that they are feeling the same emotional reactions as you are. Remember to keep in mind that although we wish to help the person, our own self care is vital as well. And this is even more so applicable in the context of BPD. This is applicable in all cases, mental illness in general, but in BPD, one of the main therapeutic supports in place to help shift the the cognitive patterns, the emotional patterns, and behavioral patterns is this relational security. It's promoting this relationship with the individual that will allow them to feel this safety, this predictability, this support, and this will then eventually support them with helping manage the emotions and changing those thoughts, the perceptions, and the behavioral patterns. So if we are feeling these reactions that are mentioned in the previous slide, so negative emotions in general in relation to the resident, which again are very normal, it is important that we just monitor them and we make sure that we keep them in check, that we get support for them. This could be done through supervision, it could be done through reflective practice, it could be done in talking with our fellow colleagues, it could be consulting with our line manager. Sometimes it's important just to be able to talk about it, to be able to monitor, to check in, to make sure we're okay. Because if our emotional responses start interfering in the relationship that we have with the resident, so let's say that we are feeling anger towards the resident and that shows in the interactions, we are we're probably giving the resident the same experiences they've had before with other people in their life that were much more significant and closer. So if they have insecure attachment styles and they've had traumatic experiences, it is very likely that those emotional experiences that they had were not tolerated. The way that they would behave would not be tolerated by their family members and therefore possibly been rejected or abandoned. So essentially, by engaging with them in this way, we're kind of repeating what they've experienced their whole life when the whole goal is to actually show them what a true relationship looks like, a healthy one, a positive one, a trusting one. So we need to be very mindful of what we bring into the relationship with the resident because that is going to be very impactful on their own well-being, and that is a very transformational therapeutic tool in the context of supporting people with BPD. Try not to feel guilty for not being able to always help the person. Engage in regular supervision and training. Ask your colleagues and manager for support if you need it. If you identify yourself that you have further training needs, do feel free to communicate that to your line manager as well. Keep a journal to write down and reflect on your thoughts and feelings. This is a common practice that is advised for people to reflect and engage in what we call reflective practice. And ideally, you do it every day for good personal and professional well-being. Do what you need to unwind and restore your energy. So when you get off work, it's important to leave work at work. So go and engage in activities that bring you pleasure. Go and engage in restorative activities that re-energize you. Could be a walk, it could be engaging in mindfulness, it could be spending time with your family, with your friends. Engage socially, engage in a meaningful way, engage in pleasurable activities that make you feel good and help you re-energize, and not focus on work, because there is a personal life outside and that also deserves your attention, and it is important that you keep this balance between the two for your own mental and physical well-being. And finally, use the employee assistance program if you need it. You can ask your line manager more about that, and there are posters across the multiple centres in NUA with the contact information, and it's completely confidential. So how can someone with BPD stay well? Individuals with BPD can overcome their emotional and interpersonal difficulties by resorting to appropriate coping strategies to manage the intense emotions and distress they feel when they get triggered. Even though this is true, it does not mean that the individual will never experience emotional and interpersonal difficulties once they have developed the skills. Relapses occur, especially during the treatment process, and that is perfectly natural in the journey to healing and recovery. Individuals and their carers should not be discouraged when this does occur because the likelihood of it occurring is high. A relapse in BPD occurs when an individual has an episode of intense emotion dysregulation that can significantly impact on their job, relationship, or just general daily functioning for a period of time, deviating from their baseline functioning. Part of relapse prevention consists in teaching the individual to expect early warning signs of relapse in future and to develop a plan on how to deal with those situations when they do occur. In the case of BPD, this includes identifying triggers of BPD. What are the early warning signs that may suggest that the person is becoming emotionally dysregulated? And a coping plan to enable self-regulation before an episode of intense emotion dysregulation occurs. Triggers vary depending from person to person, but a person who knows already what their triggers are, they can manage those triggers by either avoiding triggers if that is absolutely necessary, or having strategies to manage the triggers in a way that it doesn't lead to increased stress or emotional stress or prolonged emotional distress. Knowing what the early warning signs look like is a very important part when it comes to relapse prevention. It may be the case that someone that has BPD, what they typically experience is that as soon as they start feeling that their emotions are starting to change, they start experiencing a deterioration in their sleep. So they start having broken sleep. Now, this doesn't happen when they're having an emotion dysregulation period, but this happens a few weeks, maybe a few days before the emotion dysregulation period occurs. So, by keeping track of the patterns, we can identify the early warning signs and we can address these early warning signs immediately using strategies before this becomes an episode of emotion dysregulation. So, the goal with relapse prevention plans is to prevent a relapse from occurring by being proactive in identification and implementation of strategies, as opposed to being reactive by the time that the episode is actually starting to occur. As a carer, there are things that you can do to support the individuals in preventing these relapses and staying mentally and emotionally well. Um, and this is more when early warning signs of BPD start to emerge or when they become more frequent, depending on the severity of the symptoms. Things that you can do are to encourage the individual to engage with relevant services and professionals. Their mental health professional team will be very important at this stage. Normalize relapses in BPD and remind the individual that even though they happen, it is easier to overcome the difficulties after having engaged in treatment. And the reason for that is because now the person is equipped with adequate coping skills in order to prevent relapses from occurring, or in order to prevent an intense relapse from occurring, or to catch the symptoms before they result in a relapse. Help the individual recognize high risk situations whereby they may be emotionally triggered, and encourage them to make a plan to deal with with them whenever faced with those situations. This is typically done in therapy and part of the relapse prevention plan, and usually strategies are utilized such as DBT, dialectical behavior therapy, and CBT, cognitive behavior therapy strategies are used in order to upskill the individual in this regard. So it's about the awareness, the emotional awareness, the identification of things that promote emotional dysregulation or that can trigger a person's emotional state, and being able to manage it effectively. In some situations, it would be avoidance of that stimuli altogether. In other situations, it's about how to approach that trigger, how to manage it, what strategies to implement when facing the trigger. For example, it could be the case that a resident may want to go to a concert and they want to, or an individual may want to go to a concert and they want to enjoy their favorite artist, but they get very triggered with loud noises and being in crowds. So one of the ways to go about it is that maybe the individual can use some noise cancelling headphones that will be able to block out some sound, but not all of it. And they may be able to purchase tickets in a seating area as opposed to a standing area where people will have a bit more space and they won't feel so much the pressure of the crowd. This is an example on how to identify how to manage triggering situations. But here it is crucial to identify the high risk situations that might lead to a relapse. It is also important to note that we cannot foresee all situations. So it might be the case that an individual with BPD might experience the loss of a significant person, so the death of a loved one, which is unforeseeable and unpreventable, and that might then result in a major episode of emotion dysregulation. So there are things that we can't foresee, but the plan contains strategies in each section, including the stage where the person has relapsed, so as to bring them back to baseline. Encourage the individual to engage in daily self care and stress management practices. The higher the stress levels are, the more likely a person with BPD is to become emotionally dysregulated. Remind them that this is natural and it does not represent a failure, and that all individuals are more prone to dysregulation under these circumstances. The only difference is that a person with BPD already experiences very intense emotions. So when they do become dysregulated, the intensity of it and perhaps the duration of it might be longer than for someone who doesn't have BPD. However, the self-care is crucial and it needs to be done on a daily basis as a proactive measure to prevent the person from becoming dysregulated. To summarize, in part two of this webinar, an introduction to BPD, how can you help? We discussed evidence-based assessment intervention procedures, currently used in clinical practice to support in managing the difficulties and risks associated to BPD. We also looked at guidelines on how to support someone who is diagnosed with BPD and someone who you are caring for that is diagnosed with BPD. You should now have a great understanding of what can be done to help people who have been diagnosed with BPD, general management guidelines when caring for someone with BPD, and how someone with BPD can stay well.